NextGenWeb recently traveled to Falls Church, Virginia to take part in a facility tour of eICU enVision, part of Inova Health System. Inova Health System is a not-for-profit healthcare system based in Northern Virginia that consists of hospitals and other health services. The eICU is a remote monitoring center that helps support medical personnel for 5 hospitals across Northern Virginia. Critical care nurses are on call 24/7 to provide this support via high-speed broadband networks.
The mission of enVision eICU is around patient safety and quality patient care. When the eICU began, it was really about being an adjunct to the nursing staff and the physician staff in the hospital. So, you know, the roles are occurring over in the hospital and patients are being cared for, but using broadband technology and video and voice technology, we are able to be in a remote site and enter into the patient's room to help support the team at the hospital. So, in other words, from 7 p.m. to 7 a.m., we have physicians in the eICU who can treat patients from a distance. 24/7, we have RNs, nurses, critical care nurses who are in the eICU and can also be a support to the staff in the hospital. And so we watch patient trends and we identify changes in patient status, and if there is a need for a change in the care, our physicians will consult with the nurses over in the hospital and will give them orders for what the patient needs at the time. eICU doesn't stand alone. They integrate with that team, and then the team takes all of their goals in the same directions to try to prevent those pieces. So I would say together with the hospital and the eICU, we have seen changes in mortality rates and morbidity rates. We still have a lot of work to do, but the more we standardize our care and work together as a team, we will see those complications decrease. So we're in 5 hospitals. We're in 7 intensive care units. We monitor 120 beds. And we monitor and support. So it's not a lot of folks think we're doing telemetry monitoring, and that's not really what it is. We're looking at patient trends, and we're looking at changes in patient status and making decisions on that. And the ways that we communicate are really very interesting because we've sort of evolved over time. We still use the phone sometimes. We can go into a patient's room using the broadband technology by, you know, if you look at an eICU nurse or an eICU doc, they have 6 screens in front of them, and they can camera in using the technology into the patient's room. There's a speaker in the ceiling right over the patient's bed, and the nurse, if the patient is able to talk, they often talk to us and communicate with us, but more of the time, because they're ICU patients, we're communicating with the nurse at the bedside. And so we can talk through the speaker, and they can talk to us. There's a camera at the bottom of the patient's bed, and there's a mic on that camera that hears the nurse's voice. And our camera can zoom in and we can see the very tiniest details. So there's a confidence level that's different than I would say that I probably had over the phone. You know, not that the doc did a great job, but they don't see what you see with this technology.
You can get a lot of information from this patient profile screen here. It kind of basically tells why they're here, the vital signs for the last 4 hours, temperature for the last 5 days, white count for the last 5 days, intake and output, how much fluid is going in and how much urine, other body fluids is coming out, you know, here. You can kind of get a lot of lab values, everything from that. It's really helpful for the doctors. So it kind of pulls it all into one convenient place. So that's, for example, if you're a doctor and you just walked in the door at 7 p.m. and the patient is coding, from this page you can get a lot of information from which you can start to make decisions. The other thing we can do, and I'm sure there again Terry told you that we can pull up x-ray pictures. So there again, frequently they'll pull in, say for example, if they just put in a line or a chest tube or something, the doctor will be asked to kind of, and we can lighten it or darken it as the patient, as the doctor prefers, but bottom line is, all this stuff can be pulled up fairly quickly. Results can be transmitted to the bedside, and those issues can be acted on if they need.